I'm Michael Grace Kawoya. I'm a professor of radiology at Ernest Cook University, and um, I'm also the vice chancellor of this university. The flagship for our university is ultrasound, and that's why I have a passion for ultrasound. I do all of imaging, all of radiology, but with a very special passion in ultrasound. Ernest Cook University sought out to get the best technology in ultrasound, and we have shopped for a couple of years, for a couple of months, until we came across the Resona A20. And we did discover that the Resona A20 answers our problems. Our problem of image resolution, and also our problem of a machine which you can apply to a wide range of disease conditions. In other words, a one-stop center in ultrasound.
The A20 ultrasound system, the premium level, has these AI diagnostics tools which are very important in getting a superior image. And the reason for having a superior image is to have the quality of this image, and then the clarity of the image, and having to see the different minute structures of the superficial ultrasound structures we are doing. So this is important in making accurate diagnosis, and it also improves the efficiency of our work.
This is the endocavitary transducer. I'll not demonstrate on this patient because it's a different indication altogether. We found this very useful in the earlier version of the Resona I9 because it has the best resolution for prostate, for prostate nodules. And so we've been able to biopsy very tiny prostate nodules using the earlier version of this endorectal transducer. And that way we're able to diagnose prostate cancer very early in men. But now with this newer version, it's going to give us even a much more clearer image, and we shall be able to see tiny lesions, almost the ones which you see at MRI. We may be able to see them using this one, and that will guide us to very accurate diagnosis of prostate cancer, which you know is a problem in men. Furthermore, we use this transducer also to treat in the treatment of prostatitis, because you can guide a needle using this transducer to the prostate and inject antibiotics into the prostate, and that will cure patients with prostatitis. So for the men with prostatitis, this is very good news. But also for the older men whom we have to screen for cancer prostate and do biopsies, this is an excellent addition to the range of biopsy armament in ultrasound.
The L33 probe. This probe produces a very superior image. The image with very high quality, with clarity, and defining the minute structures of any body part you want to scan. You can watch the probe and my image. So immediately you can see these structures, and you can see the flexor tendons, and you are able also to see the deep tendons, which are the flexor dictorum superficialis. But you're also able to see the echo-pure band arching over the flexor tendons, and this is the annular pulley. And anterior to this is the subcutaneous tissue, and then you can see the skin.
We have been the leaders in ultrasound for almost 2 decades, and for us to keep pace as leaders in ultrasound, we had to get the latest technology in ultrasound. One of the commonest investigations we do here at Ernest Cook University is prostate biopsy, looking for prostate cancer. Now, for prostate biopsy, you need a machine which can show you a small nodule of about 2 to 3 millimeters or 4 millimeters. And the latest Resona we had, the Resona A9, was very good at that. Now, the Resona A20, we believe will be able to see even much smaller lesions. And so our biopsies will be very accurate, and we shall be able to diagnose prostate cancer very early. So that's very good news for men as well. Now, how about people with skin conditions? We shall be able to diagnose skin conditions using this machine, because it has a transducer of 33 megahertz. No other machine in the world has that. And so with that, you can see dermatological lesions, disease of the skin. You can see nerves and vessels within the skin. And that's a very good addition. That wasn't around in Africa up to now. And then in addition, there are liver diseases. There's liver cirrhosis. There is hepatitis. This machine can differentiate between fatty liver and hepatitis, and also a cirrhotic liver, and can measure the degree of fibrosis. And then you can be able to know, is this patient at a risk of getting cancer or not getting cancer? So all this full range of imaging solutions are provided in the Resona A20. And so the Resona A20 is a machine which reveals that which matters. And we believe we are going to see that which matters in our patients. Thank you.
If we talk about briefly to our some advanced functions, we have new function for the inflammation of the tissue. We can check with viscoelastography. And also we have M reference live function. We can make a combination between the fatty liver lab, fibrosis, steatosis, and inflammation at the same time together.
Hello everyone, my name is Karim Askar. I'm the marketing manager for Cairo Medical Group. I would like to congratulate ECU and Professor Kawoya and all the team of having the top-notch quality in the industry from the ultrasound diagnosis machine. Actually, this is not the first cooperation between Cairo Medical Uganda and Mindray. We have collaborated with Professor Kawoya for the skill lab, and then after that for the Resona A9 machine, and then finally we are dealing now with the Resona A20. So thank you very much and congratulations.